The number of active COVID-19 cases has been dropping over the past few weeks in South Dakota.
However, the state's positivity rate remains high, and that means the virus is still spreading at a high rate. As KELOLAND's Tom Hansen reports, doctors at both Avera and Sanford and Sioux Falls are aware of the numbers and the need for more testing.
During this pandemic, there are all sorts of facts and figures thrown at us, and these numbers may be confusing at times, but they give medical professionals a roadmap of sorts on what's working and what's not. When it comes to the positivity rate, the higher the number, the more concerning it is. In fact, it was the first thing that Avera's Dr. Michael Elliott addressed at today's city briefing on the virus. He says South Dakota has the second highest positivity rate in the country. Only Idaho has a higher rate.
We also have the second lowest number of tests per 100,000 people. What that should tell us is we need to do more tests. If our State Department of Health can do more tests, if we can contact trace better, we're more likely to identify when hotspots flare up.
The CDC recommends a threshold of less than 5%. Right now, South Dakota has a positivity rate of almost 17.5%. We asked doctors what can be done. They say testing and isolating, especially those who are asymptomatic. Research is showing that half the people who get COVID in South Dakota right now get it from someone who has no idea they're even sick. And the only way to find these people and slow the spread is through more testing.
50% of the time, you or I or anyone who's gotten COVID got it from someone who didn't have any symptoms but was contagious and able to spread it. There's no screening that's going to stop that. It's got to have to come through testing and then appropriate isolation and quarantining after that.
More free testing is being made available, and Dr. Mike Wilde of Sanford says they will be getting new equipment in January that should mean faster turnaround times for test results. Both doctors agree the more testing and the quicker the results, the easier it will be to stop the spread. In Sioux Falls, Tom Hansen, KELOLAND News.
And more free testing options are being made available through drive-through testing in Hy-Vee parking lots to at-home saliva tests. And a reminder, most insurance will cover 100% of the cost of a COVID test.